Ya, Assalamualaikum semua. Tak sabar kan nak dengar perkongsian malam ni. Jadi ajak yang belum masuk lagi live malam ni, cepat ajak diorang. Sebab rugi tak dengar perkongsian hebat daripada panel jemputan malam kita. Okey, masih sempat lagi nak ajak. Sementara yang ada kat sini, jangan lupa untuk daftar pada link Google Form yang akan disediakan. Kalau ada apa-apa soalan, sertakan pada bahagian komen. Nanti akan diajukan semasa sesi soal jawab di akhir perbincangan pada hari ini. Cepat ajak lagi ramai-ramai masuk. Okay, baiklah, semua dah masuk ke? Kalau masih belum masuk, ajak lagi sempat untuk dengar sharing daripada alumni jemputan kita pada malam ini. Sebentar lagi, kejap lagi kita akan mulakan. Jadi, nanti-nantikan program kita pada malam ini. Okay, baiklah. Assalamualaikum warahmatullahi wabarakatuh dan selamat malam semua. Anda bersama dengan saya, Muhammad Syahmi, dalam program A Diary of Frontliners. Okay, program ini merupakan program kerjasama antara Majlis Perwakilan Kolej Empat Belas dan juga Majlis Perwakilan Kolej Tujuh Belas. Okay, apa khabar semua? Musim sekarang ni kenalah banyak tanya khabar. Yelah kan, sebab jarang jumpa, semua kena jaga social distancing. Okay, di sini kami ada doakan semua sihat sejahtera bersama dengan keluarga tercinta. Okay, walau bagaimanapun keadaan kita dalam PKPP ini, SOP kebersihan tetap harus dijaga. Okay, baiklah, di sini kami juga nak ucapkan selamat tahun baru kepada semua penonton rumah. 2021, cepat je kan masa berlalu. Semoga tahun ini menjadi tahun yang lebih baik untuk kita semua, berbekalkan dengan azam tahun baru. Cuba komen sikit, apa azam korang untuk tahun ni? Komen dekat ruangan komen. Okay, Alhamdulillah sihat daripada Aisyah Tamizi, Fatin Nur Anafasni, baik. Izzah Razak saya di sini. Cepat komen lagi. Muhammad Zarif Muaz Lokman, wash hands. Nur Atika, diet. Azam tahun lepas tak tercapai, make it happen this year. Angelica Lipianova, Syami, please notice me. I notice you. Aisyah Tamizi tanya, saya nak dapatkan kulit glowing macam moderator. Fatin Arna Fasni, flawless ni. Apa rahsia moderator? Oh, saya pakai Mary Kay saja. Okay, untuk pengetahuan semua, self promote, saya merupakan beauty consultant Mary Kay. Kalau nak dapatkan tips kecantikan kulit, boleh roger je saya. Okay, baiklah, tanpa membuang masa, sebelum kita mulakan sesi perkongsian kita pada malam ni, kepada semua penonton di rumah, link Google Form, QR Code untuk pendaftaran dan juga sijil merit akan disediakan di akhir slot perkongsian kita pada hari ini. Jadi jangan lupa untuk screenshot bukti kehadiran awak dan juga daftar sebagai tanda sebagai evidence awak hadir pada program pada malam ini. Sebab apa? Sebab e-merit dan e-certificate akan disediakan pada awak semua. Baiklah, apakah topik perbincangan kita pada malam ini? Syami tak nak bagi tahu lagi. Awak semua kena tonton video montaj yang disediakan selepas ini. Lepas tayangan video ni baru Syami akan bagi tahu tajuk perbincangan kita pada malam ini. Okay, mohon maaf atas masalah teknikal sebentar tadi. Okay, baiklah, alhamdulillah. Begitulah serba sedikit tentang hala 7 program kita pada malam ini. Program kita pada malam ini, A Diary of Frontliners, merupakan sebuah program berbentuk perkongsian pengalaman dan cabaran yang dihadapi oleh barisan frontliners kita sejak pandemik COVID-19 melanda negara kita, sehingga Perdana Menteri Tan Sri Muhyiddin Yassin mengisytiharkan Perintah Kawalan Pergerakan pada 16 Mac tahun lepas. Okay, kalau ikutkan sebenarnya pada malam ini kita ada 2 alumni jemputan yang merupakan frontliners bagi negara kita, tapi hanya satu sahaja yang dapat hadir. Lagi seorang tidak dapat hadir kerana ada masalah yang tidak dapat dielakkan. Okay, sebelum kita mulakan sesi perkongsian kita pada malam ini, eloklah kita berkenalan dengan alumni jemputan kita dahulu. Sebab kata orang, tak kenal maka tak cinta. Okay, alumni jemputan kita pada malam ini merupakan lepasan graduan dalam bidang perubatan dan merupakan alumni kelas 2019. Alumni UPM kelas 2019. Sekarang, beliau berkhidmat sebagai pegawai perubatan siswazah di Hospital Kuala Lumpur. Bukan calang-calang alumni jemputan kita pada malam ni. Hebat bukan? Okey. Jom kita alihkan pandangan kita ke alumni jemputan kita pada malam ini. Dipersilakan Dr. Lee Chifai atau lebih mesra dikenali sebagai Dr. Steven. Welcome, Doctor.
Hello everyone. Hi everyone, it's so good to see all of you tonight. So first of all, I would like to thank the organizer for having me tonight to discuss on the current hot issue, which is the COVID-19 pandemic. So basically what I will be doing tonight is to share my personal perspective as well as my personal experience in these few months of pandemic. And of course, if you have any questions, you can actually put it into the comment and I'll answer you during the Q&A session to the best that I can. So it's so nostalgic to be here because I still remember way back last time, I still attended all these alumni talks and collect merits for my college stay. And now I'm giving the talk back, and it's so nostalgic. Very happy moments in UPM, to be honest. So just a brief introduction about myself before we move on to the interview session. So I'm Stephen Lee. So I actually finished my professional tree examination in June 2019, and I got my graduation graduation ceremony in September. Okay, so my happiest moment at the time was that when I was announced as the gold medalist for Malaysian Medical Association. That was really, really blessed. Yeah, very, very blessed and really, really honored at the moment. And currently, I'm serving as a house officer in Hospital Kuala Lumpur, and I am in the internal medicine department, living my dream because my goal is to become an internal medicine specialist, and I'm really doing what I like right now. So I'm really, really happy lah. And besides being a doctor, I actually work as a biology teacher as well. So I've been teaching for the past 10 years actually. Previously, before the pandemic hit our country, I actually co-own 2 tuition centers with my partner, in which I'm actually in charge of the subject of biology. But because of this pandemic and a lot of unforeseen circumstances, I have to close my centers, and now I've moved from traditional physical teaching to online teaching. Okay.
So you're teaching your students online right now?
Yeah, now it's online. Last time when I was in UPM doing medicine, I'm actually teaching 4 days per week when I'm still learning in UPM. I was Tuesday, Friday, Saturday, and Sunday. I teach 4 days, and at the same time, I learn also in UPM. So yeah, now I'm still doing, but I'm doing in an online manner, just like how we are conducting our interview tonight. So if any one of you have any family members or friends who want to join Form 4 and Form 5 Bio, can find me as well later on, okay? Besides that, I previously, before the pandemic, I was also honored to be invited to various schools because I am actually coming from Kuala Lumpur. So I got invitation from a few schools like Methodist Boys School, Sekolah Abdul Baki, Victorian Institution, to give talks about biology, and sometimes it's just a motivation for them to do some courses like STPM and stuff. But because of this pandemic, last year I just got the opportunity to attend one talk in SAB last year in February. That was way before the lockdown and stuff like that happened. So I think that's pretty much about me. And of course, later on, we will discuss more about the questions and issues about COVID-19. Of course, if you have any questions to ask me besides the COVID-19 pandemic, you are welcome to do so, and I'll answer to the best that I can. So yes, shall we?
Okay, tengok. Panel jemputan kita pada malam ini bukan calang-calang orang dia. Banyak pencapaian yang dia dapat, gold medalist, and also ajar student in biology.
Yeah.
Sangat Masya Allah, tak tahu nak gambarkan macam mana. Okay. Before we proceed on with the questions, I would like you to share with us as an alumni and any kata-kata semangat or encouragement for those who are watching this live tonight.
So I believe the hottest topic right now would be the COVID-19 pandemic, and it has changed our life in so many different ways. It has changed our healthcare system. It has changed our economics. It has changed our education system. So the most important thing right now is actually to stay safe, practice the SOP and the guidelines outlined by our government, KKM, practice safe hygiene, safe social distancing. So health is always the first thing, okay? So after you take care of your health and the ones that you love, then you will move on to achieve other things in your life, like for example, your academics. I believe all of you are students from UPM. So I really wish all of you to be able to adapt to this new normal, because I'm not sure how lessons are conducted right now. I believe most of you are doing online lesson with your lecturers and examinations. I'm not sure how it's being carried out, but then I will wish all of you to strive and try to adapt to this new system and do the best that you can. Okay, so yeah, that's my biggest wish to all of you.
Alright, okay. Untuk semua penonton di rumah, sekarang ni kita masih belum menang lagi. Kes sebelum masuk tahun baru dah naik, dah meningkat sebanyak 2,552 kes. Jadi kita harus jaga SOP dan juga kebersihan kita sendiri. Health is our priority. Pandemik yang lebih dahsyat berbanding dengan pandemik sebelum ni. Sehinggalah Perdana Menteri kita isytiharkan PKP bermula pada 16 Mac tahun lepas dan berperingkat PKPP, PKPD. Okay, di sini I want to ask you a question.
Oh yeah, sure, Shami.
What is your first impression when the coronavirus strikes our country in the first place? I think it started in January, right?
Yeah, actually, we actually know that this virus existed in in December 2000 in September, sorry, is in December. So in the very beginning phase of the coronavirus, actually we didn't notice about how infectious or how much of morbidity or mortality the virus can actually give to the people. In fact, in January, I actually went to China at the time for a trip, for a tour, because just after graduation, guys, so we just go, specifically I went to Beijing and also Harbin. So at the time, actually, the virus has already started in the December before that. But when I went to China at the time, no one in China, okay, when we go to all the crowded places like in the railway stations, Beijing railway station is seriously no joke. And we went to like Harbin, all the tourist sites. Literally, there were no people wearing masks at the time. And people at that time, actually, they didn't even know about the existence of this coronavirus, okay? Only until at the end of January, the time I really came back from the tour, and the time China government suddenly announced the sudden lockdown, okay, in China. Only at that time, we see how serious the infection can be and how easy the infection can actually spread from one person to another. But it's actually kind of too late because this infection has already spread outside of China. We've seen spikes in Europe, for example, Europe countries. And yeah, in the beginning, we all thought that it was just like a normal flu. But if you compare with the normal flu, it is not as infectious as normal flu. But in terms of mortality and morbidity, it is actually substantially higher, which can actually cripple our healthcare system, as we can see in some European countries, even though they are so advanced, but they do not have enough healthcare support. Okay, they do not have enough healthcare facilities. They don't have enough ventilators, and this actually is a very serious issue. But of course, in the beginning, none of us know about this because this is a very new and emerging virus. So our countries, if I'm not mistaken, it was in February when we got our first case. It was a man coming back from Singapore and developed fever, cough, and symptoms like that. Eventually, he got diagnosed as coronavirus. But at the time also, we didn't know how serious is it until like in the mid of March, like you said, 16th of March, if I'm not mistaken, that our government actually imposed lockdown. Then we really see how serious is that. But I believe at that time, a lot of people also, they don't think that a lockdown was necessary. They think that it's just like a normal disease because people, they don't understand at that time that about this coronavirus is something that's too new for them, I guess. And we have not faced such a serious pandemic before. Last time we have the SARS-CoV-1, but the time didn't hit our country. It was like in Hong Kong and countries like that, but it didn't really hit our country. So we were not really prepared, and we didn't know what to expect about this infection. And this infection has, like what I said, it affected deeply our economics, education, and almost all the sectors. So yeah, in the beginning, none of us know about this, but now we get to know more about coronavirus, but we still haven't found out the total truth about this infection and what kind of pathogenesis or pathophysiology can it bring out in the future. That one we still don't know. We're still unsure 100% about this virus. Yeah, Shami.
Okay, thank you, Doctor. Okay, daripada sini kita boleh nampak betapa seriusnya masalah COVID-19 ni. Pada mulanya memang kerajaan di China tak anggap ia sebagai satu masalah besar, tapi bila ia start ia start untuk merebak ke seluruh negara, mulalah kita dia start untuk spread sampailah ke negara kita, and then muncul beberapa kluster macam kluster sekarang ni. Okay, nasib baik sekarang ni semua sedar tentang kepentingan membasuh tangan, dan juga
harap semua sedar, tapi
harap semua sedar.
Yeah.
Okay, moving on. Like macam video yang kita tengok tadi, kita tengok betapa susahnya barisan frontliners kita berhadapan dengan pesakit COVID. Bermacam-macam dugaan yang mereka hadapi. Jadi as a frontliner doctor, what are the challenges that you face during this pandemic?
Alright. To be frank, we house officers, we don't deal directly with the COVID patients. Actually, we need to be at least a medical officer level or specialist consultants level before you can actually deal with the COVID patients directly. But because we're staying in the hospital, we got a lot of these chances to deal with these COVID patients. Why I do this is because, okay, so let me explain to you. This is the flow, okay, in which a patient presents to our hospital setting. I'm not sure about other center, but in hospital it's something like that. So when a patient presents to our center, we will normally screen them for this COVID-19 infection, in which we ask them a few questions. We'll ask them whether do they have symptoms like fever, cough, loss of smell, loss of taste. There's a series of questions we will ask them. And we would like to ask whether they have any contact with COVID patients or not. So if they don't have any symptoms and they have no positive contact with the patients, so normally we'll put them under non-SARI. So SARI, S-A-R-I, stands for severe acute respiratory infection. So non-SARI. And depending on what symptoms they present, we will send to respective departments. So take, for example, previously I was in orthopedics. So in orthopedics department, all the patients before undergoing surgery have to get the swab done. Okay, so swab comes in two forms in a hospital. It's either the RTK swab, or we call it as a rapid test kit, in which the result you can get around 2 hours. Okay, and another one that we normally do for patients who are not requiring urgent surgery will be the oropharyngeal swab PCR. Okay, that is orthopedic practice. We will screen through all the patients in one ward, and if they tested negative, then we'll shift them back to the normal ward. Okay, but in medical that I am in right now, because you have to compare the load of patients, medical patients are too much. There are too many medical patients. So it's impossible in terms of economically to screen all the patients for COVID-19. So some of them who claim that they have no symptoms and they have no positive contact, we'll put them in a normal ward. Of course, we practice safe social distance. Okay, there are 1 meters rule and all that. But especially recently, okay, when we have this third spike of waves of this coronavirus, we actually witnessed a lot of these hidden patients who came to our ward that we thought that he or she was actually fine, eventually came out as COVID positive. We have a lot of these cases. Okay,
Ramai kontak rapat lah.
I don't know whether they're lying or they memang tak perasan dia ada kontak rapat dengan orang yang dapat coronavirus. Tapi awal-awal dia memang tak bersimptom, tak bergejala. Okay, and then he or she also claimed that don't have any contact rapat, but eventually came out to be positive. Okay, and that is going to be a big challenge, because if one patient in the ward was diagnosed positive, it's going to affect the whole ward. When you talk about whole ward, we're going to swap all the patients. Like, for example, what happened in my ward for the past 2 weeks, we have one houseman who got positive coronavirus. The consequence was the whole ward has to be frozen. That means we cannot get in new admissions, and the patients couldn't get out also. We have to swap them depending on a strict protocol, some of them even up to 3 times. Okay, and all of us, house officers, medical officers, consultants, specialists, nurses, even the pharmacies, the dietitians, the physiotherapists, all of us, we have to go and get swabbed. Okay, so that's the challenge, because we every day in work we are tiptoeing. We don't know is the patient really COVID free or not. So at the back of our mind, we're really thinking, is this really COVID? But of course, we also understand COVID presentations are extremely vague. there might be some people who present with these kind of symptoms, fever, cough, but eventually turn out to not to be COVID. That's also a possibility. So that's why we are like tiptoeing day and day. Okay, so that's the first problem. We are dealing with the invisible enemy. We don't know who is really gonna and who does not, and who didn't. Another problem that we actually face is that the shortage of staff, because a lot of us, like the medical officers, we are allocated to, like, for example, taking care of these COVID patients. Okay, or let's say, take for example, like my friends, a lot of them are quarantined for the period of 10 days because of this COVID-19. And we are so short of people to take care of this huge load of patients. So if you ask me what are the challenges that I face in the hospital, these are a few challenges that I can actually think of in terms of healthcare in my hospital right now.
Okay, let me recap back the challenges. First is bila in satu ward, if ada pesakit yang disyaki positif COVID, yang lain pesakit-pesakit yang lain semua tak dibenarkan keluar ataupun pesakit baru masuk dalam ward tersebut.
Bukan disyaki, sometimes we'll confirm lah by using the swab test. Tapi kita memang tak tahu sama ada patient tu ada COVID ke atau tak ada COVID. Itu masalah yang terbesar sebab kita tak ada test kit yang mencukupi lah untuk test semua patient. Ideally, kalau kita boleh test semua patient, itulah paling bagus. Tapi kita tak ada test kit yang mencukupi. So kita hanya boleh test patient yang ada yang bergejala ataupun mereka ada kontak rapat dengan COVID positive patient. Dan baru kita buat test. So sometimes bila kita buat ujian, come out as positive. So kita kena screen semua healthcare professionals, semua patients, semua orang kena screen. And bila kita pergi screening, mereka akan tanya beberapa soalan lah. So dia akan stratify kami sama ada kita dalam high risk ke, medium risk ke, low risk. So kalau high risk ataupun medium risk, mereka tak boleh kerja dah 10 hari quarantine. And then kita akan bagi you itu gelang pink. We'll give you a pink band. So you cannot work already. So maksudnya kita punya healthcare fraternity sudah kurang orang. So masalah kedua, staff or we say the healthcare professionals will not be enough lah, not be sufficient. So that's another problem.
So basically, if like dalam hospital, if seorang patient disyaki memang test positif COVID, memang akan affect the whole system in the hospital.
Definitely, especially kalau dia berada dalam non-COVID ward, dia didapati COVID positive, consequence is really, really very huge lah. We can see it's very huge. And it's happening everywhere in the hospital, not only in medical. In orthopedics also it's the same. I'm not sure about the surgical or what, but in orthopedics, in medical, it's the same. Like surgical is even worse because a lot of surgeries have to get postponed. Those elective surgeries, they have to get postponed. So that is very, very bad, affecting our healthcare system. Supposedly people should get, like, for example, in orthopedic, they might be getting a knee replacement, but knee replacement is not like a life-changing surgery. So they might postpone the surgery or even delay the surgery. So that is like affecting the living quality of the patient. Yeah.
Okay. Can we know the real situation of this pandemic based on your experience?
So what I said earlier on was actually the challenges lah. And those are actually the current situation that we are actually facing right now. But currently, if you look at the real situation, the hotly debated topics recently will be the UK new mutated strain. That is actually a new topic correct not? Okay, and also we are dealing with because we find out that this UK mutated strain, okay, actually it is much more infectious. They say, okay, according to the UK president, it's like around 70% more infectious than the usual coronavirus. But we haven't have a solid research to prove that it causes more mortality or morbidity. So what we can confirm is this new strain of this UK new strain of virus is more infectious, okay, but it might not be more deadly, okay, or more morbidity. That's what we can tell from the data that we have right now, okay. And luckily, it hasn't spread to Malaysia yet, okay. According to the newest news, it haven't spread to our country yet lah. Another hot topic that we are actually quite concerned will be the vaccine lah. Okay, the vaccine. So for that also, we now already have the vaccines, okay, and it's proven to be efficacy at around 95%, as claimed by the company, okay. We have the Pfizer and also the Moderna lah. These two will be the vaccine companies, okay, who are actually creating these vaccines. But also there are a lot of issues to be settled. Okay, we currently still don't get our hands to the vaccines yet, and that will be the issue of discussion in the nearest weeks or months in the future. Yes.
But the vaccines already have arrived in our country, right?
For that, what I know is like in early February, if I'm not mistaken, it will be in early February, as according to the
Early
news.
February.
Yeah. So, and we have not really disseminated the vaccines yet, like we haven't really give to the people yet right now. Yeah. There are also a few problems about these vaccines, like the cold chain storage and things like that. But I think that is beyond our discussion of this interview. But if you talk about recent situation, will be this UK mutated strand and also the vaccine topic and of course the challenges that I said just now. Looking at our numbers right now is climbing. Another big problem is that the spike quite not. Every day we're looking
Now it's the third wave.
like every day we are dealing with 2,000 over of cases. So it's really bad. But the thing is, if you see the supermarket and stuff, you notice that people actually really don't pay as much of attention as in the middle of the pandemic. So if you look at the whole flow, in the beginning, people didn't care because we didn't know what was that. In the middle, we start to be afraid because we see a lot of news, we adhere to this and that. And now, actually, we start to see a lot of people, they don't wear the mask properly. You can easily find all these people anywhere in the road. You can see not wearing mask properly. Some of them even not wearing masks, not practicing
Not following the
social
SOP
distance.
correctly.
Yeah. So this is like, I think this is a recent situation that we can see because to them, these are just numbers, you understand? But when you never get the disease, you never know the consequences. So for them, 2,000 is just a figure. I mean, to them, okay, to this sekelinte, sekumpulan orang not everyone So, yeah, that's another
Dia
thing.
belum sampai tahap bila kita kena sendiri, kita baru
Betul.
tahu rasa dia macam mana.
Betul. Memang macam tu punya orang punya behavior. Kalau you tak kena, you tak care you akan buat benda yang you suka. Correct not? But then once you kena, the problem is you kena, if you are young, most of the time you are going to be fine. Most of the time, not all the time. Most of the time you're going to be fine. But what about your parents that you're staying with you?
The elders.
The elderly.
Because their immune system are not quite strong.
Betul. Because we also have seen from the papers, people with hypertension or people with diabetes, the chance for them to get severe respiratory infection is actually even more than the young people So kita tak boleh macam pentingkan diri, like I only care about myself, I want to go outing with my friends, but at the end you get the disease and you spread. That is like a very bad thing because we see a lot of clusters are actually from family based. That's the first thing that comes about cluster from household. That's the number one correct. So yeah, this is the recent situation
Okay, untuk semua penonton di rumah, kalau ada soalan jangan lupa untuk sertakan pada ruangan komen. Nanti akan diajukan pada Dr. Steven pada akhir perbincangan kita pada malam ini. Okay, lepas dah dengar sesi perkongsian doktor tadi, kita boleh tahu betapa severenya virus COVID-19 ni. Sebab kadang-kadang kita tak tahu bila kita dapat simptom COVID tapi bila tested is not positive. So kita tak boleh agak if orang tu positif atau negatif dia punya from the test. So it's better for us to betul-betul jaga kebersihan, follow SOP. Kasihankanlah frontliners kita yang bersusah payah. Okay, moving on with the next question. What are the procedures that needed to be done before handling COVID patients? From what I know, there's a lot of things that the frontliners need to put on when they are.
So I believe in the beginning just now I have already mentioned some of the screening procedures that we do in the emergency department. But I can share with you about what you mentioned, Shami, just now, all the baju, everything that we wear. That is what we call as PPE, person protective equipments. So we actually have a few. I'm not sure whether it's the same for all the hospitals, but in our hospital, we actually got PPE A, PPE B, or PPE C. So PPE A is when you're dealing with a confirmed case of COVID. So you have to wear a few equipments lah. So you have to wear the head cover, okay? You have to wear N95 or KN95 mask. You need to wear a face shield, a long sleeve fluid repellent gown, a pair of gloves, an apron, and also a shoe cover. So this is what we call a full PPE. And I can tell you it's really, really super hot inside that whole full suit.
Because there are many layers of clothing.
Yeah,
that
many
you need
layers,
to put
and
on.
it's really, really, really hot. And especially when you're working in a situation that you have no aircon, it's like really like a microwave oven lah. After you wear the whole thing, like for a few hours, you come out, you can actually get all your sweat. Okay, just like the baju just baru baso like that lah. So that is actually the PPE grade A lah. Okay, so for B, it's like when you're dealing with high risk patients, it's not really confirmed, but like for example, when you're in the ED, in the SARI ward, they're not confirmed but suspicious. So you can wear like that. Okay, you don't have to wear the head cover. You don't have to wear N95. You can just wear a normal face mask with a face shield, still with the gown, okay, with a pair of gloves, apron. That is B. When you're dealing with suspicious patients, not confirmed case, then you can wear like that to see them. So for PPE C is when you're dealing with normal patients. Like I said, normal doesn't really mean normal all the time. Sometimes they look normal, but they are not, okay? So that's why we, dealing with normal patients also, we will practice PPEC. So PPEC got two types. Whether you are dealing with the patients or you're just dealing in the compound, okay? So if you're dealing in the compound, normally what we'll wear is the mask and also the face shield, okay? A mask, face shield, and apron. That is what we normally wear lah. But when we're dealing with the patient, we will wear mask, face shield, apron, gloves. And the apron and gloves, we will change from patient to patient lah. So lepas examine this patient, when we go to the next patient, we will change our gloves and also we change the apron, yang plastic too. It's just a plastic apron lah. So we throw that and then we change a new pair. So that's the one that we are normally doing in our ward rounds and stuff every day lah right now.
Like from your experience, doktor pernah pakai semua
Pernah. Sebab sekarang kalau kita kena escort patients, like for example in the ward, tiba-tiba mereka ada symptoms bergejala, so you have to bring them to the ward, right? So you have to wear like, you have to don the what do you call that, PPE lah. So we have to wear. So even though we don't directly deal with them, but I think a lot of house officers also have done before lah, because we have to indirectly deal with them sometimes. Yeah.
Okay, I read an article from Bernama before today. The author mentioned that foreign workers are reluctant untuk menjalankan swab test because employers diorang tak izinkan untuk have that test. Based on your perspective, macam mana how does this affect the number of cases in our country?
This is actually a big problem. First of all, we have to see lah, sebab all these foreign workers, okay, they are living in such condition that is very crowded, okay, very poor sanitation in terms of the housing area. So this is like a breeding ground for the COVID-19 virus, and it can create clusters. And that's the reason why it's very important for us to screen all these foreign workers. But the problem is we don't offer free tests for foreign workers, okay? And that's why we need the employers, okay, to volunteer the money for the workers to do the swab test. So that's the reason why the employers cakap mereka tak bagi. Sebab bukan tak bagi. Kalau free, of course bagi. Masalah dia, you kena bayar. That's the problem. So the employers, they don't want to pay. But the problem is they don't see, when you do a swab test, I'm not sure in private how much does it cost. Maybe in 300, something like that, 200 to 300. I'm not too sure about the real price. But the thing is, if let's say one of your workers kena, and it affects the whole team, then definitely your company is not going to be running, isn't it? And you are going to be suffering from more losses. So that's why I
Yes.
think these employers, they actually should weigh the pros and cons. Okay, so whether you want to spend a relatively small amount of money to let your foreign workers to undergo the tests so that you can actually continue with your project with ease, ataupun you want to take the risk, or I don't want to let my I don't want to let my workers to go because I want to jimat the money, and eventually if really one of them kena, then the whole construction have to be stopped and you are going to suffer from the loss as well. That's the one thing. But the second thing is, I think government should also impose a stricter rule. If I'm not mistaken, the newest from the newest news, we know that actually we are trying to impose fine. Okay, kita kan bagi denda lah for those employers who are not funding their employees to go. If not mistaken, they say it's roughly about 50,000 per worker. Okay, if found out that they are actually positive. So that we still have to see, because it's not, the regulation is not yet confirmed lah. Okay, but if you ask me, not screening the foreign workers, is it a dangerous thing to do? Obviously, it's very dangerous. You're trying to say in normal citizens, okay, we also facing these kind of issues. When they're living in such conditions, when the sanitation is so poor and they're living so crowded, all of them staying together, and when they are not just at the same place. They will also go to the shops that you and I go, isn't it? They will go to mamak shop also. They will go to all the places that you and I will go. So eventually, it's going to bring to the community as well. So yes, this is going to contribute to the spike lah. And I believe that we have to solve this issue as early as possible lah, because this is actually a potential cause of the spike. Yes.
Yes. Okay, untuk semua penonton di rumah, kalau anda ada symptoms macam batuk, sesama, sakit tekak, demam panas, cepat-cepat terus pergi buat test, sebab kita tak tahu if parents kita yang baru balik dari kerja ada kontak rapat dengan pesakit COVID. Jadi it's okay to invest on something that will not just benefit to you but also to the others. Okay. Okay, lately the number of cases in our country increased drastically. Like I mentioned in the first introduction, where sehari sebelum masuk tahun baru, kes kita meningkat sebanyak 2,552.
2525.
How
Betul.
what are your thoughts on this? Like macam mana dia boleh bagi efek kepada negara pada tahun ni?
Actually, this year is still a very unforeseen year lah. Kita tak boleh predict apa yang akan berlaku in the future. But then, hopefully, by the help of the vaccine, we can sort of control the situation lah. But it's still too early to say anything, because we have not seen really it's so to be used in the community level lah. But then these numbers 2525 is really scary. Sebab dia boleh naik secara mendadak. It's not like it's going to be stay at that number. If let's say SOP is not properly taken care of, it can actually rise up, just like what we see in the European countries, 10,000, 20,000, 30,000 per day. So when you reach that situation, the problem is you are going to cripple the healthcare system. Cripple the healthcare system maksudnya apa? Maksudnya we don't have enough beds for the patients. We don't have enough facilities for the patient. We don't have enough staffs for the patients. We don't have enough ventilators for the patients who are having severe infections. So the whole healthcare system is crippled. And the worst thing is, what about those other patients who are not having COVID-19? Like last time when we imposed the lockdown, it's creating a lot of problems, especially like we are doing in HKL. HKL is a tertiary centers. We receive referral from a lot of other states. Ada yang datang dari Johor, ada yang datang dari Negeri Perak. So when they come to our places and you actually impose lockdown, and it's difficult for them, actually a lot of them will default the treatment. Some of them are cancer patients. Some of them need to do chemotherapy. So what about those patients, isn't it? So just have to understand that we are not just dealing with COVID alone. Even COVID is the big title right now. We still have other infections. We still have other diseases. We can't just put all the focus in one thing. But if the cases are still rising exponentially right now, so that's what's going to happen, isn't it? But we can't afford another MCO. Just like last time, a lot of people say, well, maybe we can have another MCO. It's easier for us to say, but economically, it's very difficult because there are some people, okay, who live simply selling nasi lemak by the roadside. You do an MCO, so how are they going to sustain their life? So that's why there's a very nice quote that they say. They say they'd rather die of COVID than to die of starvation. Correct or not? So if they don't have the money, so how are they going to get the food? How are they going to sustain their life? How do they sustain the family? So that's why we are very fortunate because most of us, we are living in a comfortable family. So we can say things very easily. We can say, just do an MCO. But sometimes we also have to take care in the whole overall picture that there are a lot of these unfortunate groups of people that if we impose one more time, it's going to sustain, it's going to affect them very greatly. And it's not a great idea for us to keep giving money. Maybe some will say, maybe the government can give support in terms of monetary support and all that. But is that a long-term solution? No, right? So that's why all of us have to play our roles to reduce the numbers. Okay, don't make this even higher and higher. 3,000. That is actually like a nightmare. We don't know whether it will happen or not, but I can tell you it's really, really a nightmare lah. Yeah.
Yeah. First and foremost, we need to do not be selfish for ourselves. Bila kita fikir, macam kita boleh cakap, senang je cakap government akan bagi CMCO. Tapi bila fikir balik, peniaga yang jual nasi lemak tepi jalan ataupun orang yang tak ada kerja, macam mana diorang nak cari rezeki? Dia akan affect the whole community in our country. Ekonomi
So
sekarang pun tak
economics versus
stabil.
health. Ya, betul lah. Tu masalah yang besar lah. Correct not? Yeah. Betul.
Okay. The next question sangat popular sebab memang benda ni berlaku dalam berita pun selalu mention. There have been cases where some people who are wearing the pink tags on their wrist but still have the freedom to wander around, going for a drink in public, which caused confusion in our community. What is your advice on this?
It's all, it all comes to one thing lah. Okay, it all comes to one thing, which is civic lah. Okay, that we really need to practice good morals, good ethics, and good civic. Okay, in which I believe actually the pink band I've seen a lot. So you say they wear pink band and go mama. That one I have never seen people so brani lah before lah. But what I've seen people doing they use the the bandage they will use to balut luka punya. They balut the hand and it can go anywhere. Correct or not? And sometimes they don't even do the Mai Sejahtera. They don't even scan the entrance before they get in, right? So
they have the audacity to break the rules.
Betul. So kalau you tanya what's my opinion? It's all depending on
ourselves,
the morals, the ethics, and the civic lah. So if you think that we only give the pink for people who didn't know, for all the dear audience right now who didn't know, kita hanya akan bagi gelang pink kalau kita suspect orang tu sama ada dia medium risk ataupun dia high risk. So apa tu medium risk, apa tu high risk? So we got a few categories that we can actually tell lah. Number one, okay, if you want to classify yourself as medium or high risk, you must be contacted to someone who have contracted COVID-19 lah, in some sense. So we need to know, okay, your contact, whether you are wearing mask or not. The person is wearing mask or not. Are both of you wearing mask? Or is it one of you wearing mask? Or both of you not wearing mask? How long is the contact? Is it only for a few minutes? Or is it like a half an hour? Or is it like 10 minutes? Number two. Number three, what's your distance between you and the person? Okay, is it like very close, very rapat? Or is it like 1 meter? Number four, okay, what kind of activity are you guys actually doing at the time? Are you eating together? Or are you just berborak? Or any other activity? So we have to depends lah. Then we'll stratify you lah. So kalau you cakap you with the patient, tapi you tak pakai mask, dia tak pakai mask, so automatically you akan high risk. So bila you high risk, kita akan bagi gelang pink lah. So we swab, kita bagi gelang pink. Lepas tu you kena quarantine kat rumah, isn't it, for 10 days. Lepas we confirm that, okay, you punya risiko memang rendah, then kita akan potongkan gelang. But the problem is people can't stay at home. You know, they don't want to get quarantined. That's the problem. So they go out, they still want to yum cha with their friend, isn't it? So that's why they still go out. So they can think of all sorts of ways. If you say the person go out with pink gelang, then I think the person is really a little bit ridiculous. Because there's so many people, they're using all sorts of methods. Bandage, upper. So what we can actually do is, I'm not trying to push the responsibility to the police or the law enforcers. We can say law enforcers can actually try to catch more of these people or this and that. Correct not? But it's not easy also for them. Correct not? Takkan all the people you with bandage, you go and open the balut and see whether is it really got pink band inside or not. You cannot do that. So I think at the end of the day, it's all depending on awareness of the people. So we really have to spread more awareness to the people to let them know how severe is this. And they have to be responsible for themselves and for the community also because all of us, we play a part in this. It's not so if you tell that healthcare professionals are heroes, if you tell that the policemen are heroes, I really don't think we are heroes. We're just doing our job. All of us play a part in this, isn't it? It's not us.
Yeah.
It's not us per se in our profession. It's you and me. You, me, he, she, they, we, all of us, we have to play a part in this. So that's the thing I say back to our moral ground Yeah, that's what I want to say.
Semuanya bergantung pada kita sebab if
Betul.
seorang kena, memang semua satu komuniti tu akan kena pada masa
Betul
yang sama.
You akan create satu
Kita tak
kluster
tahu.
baru kan. So kalau you dapat gelang pink, then just berada dalam rumah and then jangan keluar dari rumah Lepas potong gelang, you pergi mana pun tak kisah Tapi bila you ada gelang tu, stay at home. Correct not? Yeah.
Yes. Moral of the story is that we ourselves play the important role in our community.
Yeah, betul.
Okay, the final question. What is your advice to the people who are watching this live tonight, and what is your hope? Apa harapan doktor selepas memberi perkongsian doktor pada malam ni kepada semua penonton di rumah?
I hope that from our interview of today, besides all of you get some merits, you actually get some information also from us that actually this COVID-19 is really something that is real. And we really, really have, all of us, we have to play our parts. I've said so many times in this interview that all of us have to play our part as a citizen, adhere to the SOP and also the guidelines that are set by the government. My hope is that all of us can return to the conditions that we were last time. Sometimes I just think back, it's just a year and the changes are so different. Correct or not? And all of us, we really miss old times. We miss travel with our families and friends, but all that we cannot do right now. So I hope that at least this year, the situations of COVID can be better. We can open the borders and we can travel to other countries happily, and we also take care of ourselves and also families in terms of our health. That will be my wish.
Okay. Doktor ada banyak soalan ni penonton di rumah nak utarakan kepada doktor.
Oh, okay. I can cuba. So, okay,
the first
tell
question.
us about. Oh, okay. Actually, I can see. All right.
Okay.
So, can you tell us about the new mutation in the UK? Okay, so this is actually the newest report They say actually in October they actually find this new mutation already. It's B117, if I'm not mistaken. B117. Okay, so this new strain of mutation is believed to be more infectious than the ordinary strain. Okay, but it's still very new. We don't know. Okay, we don't know whether is this more deadly or not. But the current researchers and the current studies have shown that it's not more deadly nor creating more morbidities, okay, but it's more infectious. That's something that can be sure, okay, just like what the UK president mentioned.
Easily infected from this virus.
So people can get transmitted from person to person more easily. Tapi bila you dapat virus tu, tak bermaksud you akan mati dengan lebih cepat ataupun you punya penyakit akan lebih serius. Tak bermaksud macam tu. Tapi akan dapat jangkitan dengan lebih senang lah. So that's the thing about this UK mutation strain. And currently they are also in lockdown because they want to, prevent the spread. But it has spread to a few countries already. Actually, not only in UK right now. There are a few European countries, even in Australia, if I'm not mistaken, they also have detected this strain of mutation. But we in Malaysia, very fortunate, we still don't have this yet lah currently. Yeah.
Okay, the next question. Okay, let me read it. Doctor, is it true that we must get multiple shots of the vaccine to gain immunity?
The vaccines, like I said right now, for both Pfizer and also Moderna, is 2 shots. Okay, so 2 shots, that means you get 1 shot. Okay, and for Pfizer, it's 28 days later, you have to get another booster lah. Okay, so you need to get at least 2 shots, multiple shots. We don't need to get like 3-4 shots, but at least 2 shots are needed lah for the vaccine for the immunity. Yes.
So the second immunity ambil selepas 28 hari lah.
This is for Pfizer lah. This is for Pfizer. Depends on the vaccine also. Yeah. For Pfizer, it's 28 days lah.
Okay. Next question for Erica, Fortree Spotter.
Hello, how do you deal with anti-vaxxers, especially people who are close to you? This is a very sad question, to be really, really honest, because whenever I see anti-vaxxers, I would think of a case that I've encountered when I was a medical student in my 4th year. So masa tu I tengah buat pediatric posting lah dekat hospital Sedang. So apa yang berlaku lah, got one child at the age of 4-year-old macam tu, dia datang dengan hospital kita lah with the symptoms of like fever, lepas tu dia keluar ram lah, rashes from the face all the way down to the legs. So it's very typical of measles. Kita panggil tu measles lah. Okay, so actually, our countries, we do offer measles vaccines, tapi tak tahu kenapa lah, the parents of the child actually didn't give the child the vaccine lah. So the child come to us initially in the first day, just got a bit of these rashes, but still can talk to you, still can makan minum dengan biasa, tak ada masalah. But then after 2-3 days, we start to see the patient punya consciousness start to drop, not able to talk to you anymore. So eventually we found that she actually developed a complication. We call it as a mesoencephalitis. Maksudnya measles virus tu dia sudah attack dia punya otak lah. So she is not able to walk anymore. She is not able to talk anymore, and she has to depend on a nasal tube for feeding purpose. So when I look at that girl, I really think that it's really, really unnecessary because it's too late already lah. You cannot blame anyone. You cannot point fingers to the person because she chose not to give the daughter the vaccine. There's so many reasons why. They can tell you because it can cause autism lah, because there are something inside the vaccines that can cause cancer lah. Correct or not? So that lady, I saw her again in when I was doing my final year, and she's still not fully recovered. She's still very mentally repaired lah. She was actually very fine before that. So it's a very irresponsible act. Anti-vaxxers, they can come out with all sorts of excuses, all sorts of reasons, all sorts of so-called research papers. Actually, the people who say that vaccines give rise to autism is proven to be a fake. It's proven to be a hoax. Tapi orang still percaya. Correct not? So what we can do, okay, in our level is that we need to educate. Okay, us, besides treating patients, kita kena educate. Because not all of us, we are very lucky because we got into university. But then we have to understand in the very basic community level, there are a lot of them who never receive proper education. So if they never receive proper education, they didn't even know what is vaccine. So in our countries, they don't know what is vaccine. They malas lah, this and that lah. So they never bring their child for the scary vaccine. So we need to really properly explain to them about what shots that they are going to take. Okay, and what benefits that they're going to get, all right? And what kind of side effects, because sometimes when they get the shot, they can get like demam and all that, but it's not going to cause very teruk punya effect lah. You can get like a bit sakit, a bit sore, a bit lemak, a bit fever. Yeah, you can get something like that. So we have to explain properly to the parents, educate them about the importance of vaccine, and also we have to make more like awareness lah in terms of media, social media, or in terms of
because there are many platforms today, so it's our responsibility to create an awareness about vaccines.
Yeah, because we just have to understand not all Malaysians are well aware about vaccine, and they don't know what is that. Some people, they just bring because they just bring, but they don't know what is that. So our job is to always educate them, tell them what is that for, so that they don't regret later. Just like what I told you about the story of that little girl. We don't want to see that, because that little girl is just very young. We destroy a girl just like that. So no lah. Okay. So to the anti-vaccine, best thing to do, educate them. All right. Yep.
Okay. Next question by Siti Nurhazika Hussein.
Doctor, when do you think the pandemic will end? I tell you, no one in this world can predict when the pandemic will end. Okay. So no one can tell you an exact date. Okay, as if when the pandemic will end. But we hope that by the introduction of the vaccines, by the adherence to the close SOP, we can reduce the case. Okay, so what do you define? How do you define ending the pandemic first? Maybe at one point, the coronavirus can just be like a seasonal flu. That means at particular time of the year, they will come and strike the people. So we don't know lah. How do you define as the end of the pandemic? But I would say not too soon lah. Okay, until we can see the effectiveness of the vaccines. Not that soon lah. Okay, but no one can predict when is it lah exactly.
Okay. Another question by Sofita Su. Why the frontliners still got COVID-19 even they already have the shield?
This is actually a very, very good question. Okay. It's a very good question to be asked. Okay. So it's not very good for me to kutuk other people, but you have to understand doctors are still normal human. Okay. Not all frontliners will practice 100% SOP. That's the problem. So if you go to hospital, you don't be surprised if you see there are some frontliners who are not practicing the correct SOP as well. So that's why nowadays our hospital actually try to impose this rule that if you kena as a frontliner, tak kisah you nurse lah, you doctor lah, siapa dah, if you kena COVID, you akan kena tindakan tata tertib. So because we all understand that logically, kalau you pakai PPE, kalau you jaga social distance, you cuci tangan you, supposedly you tak akan kena. So kenapa you kena? So that's why they keluar this surat lah. But a lot of us, we tak puas hati lah. Wah, we so penat jaga patient, suddenly kena. But because some of you understand, you know, like in my ward, the one who kena is not the patient. The one who kena is the houseman.
The staff.
It's a staff. So bila you makan dengan staff, sometimes in the you have to understand, you might not be able to picture the whole situation, but sometimes when you makan with your staff in the room, takkan you pakai mask, right? You will remove your mask, isn't it? And then you makan with the staff, but you don't know that the staff has contacted with the COVID patient. So the problem is not having the shield. The problem is, do you use the shield? That's the problem. And the person that you contact, is it 100% safe? No one can tell you. So we are like, every day we deal with invisible enemies. So we take care of ourselves. Understand? Okay? Yep.
Jadi semuanya bergantung pada tanggungjawab kita sendiri untuk jaga SOP.
If you have proper SOP, supposedly won't get lah. Unless there is some leach in the equipments or sort. But most of the time, I think it's because of non-adherence towards the strict SOP. That's the main problem, I believe.
Okay. The next question by Arif Johari. Hi doctor, there is any tips on how to deal with anxiety problem that is caused by COVID-19?
Okay, so first of all, to a lot of people, anxiety might sound like a very common thing. But first of all, we understand, is the anxiety pathological anxiety? That means, is it a disease or not? Because kalau you tengok dalam psychiatry, okay, kita memang ada satu disease kita panggil GAD lah, Generalized Anxiety Disorder. Kalau you diagnose dengan disorder tu, then memang you kena dapatkan treatment lah, okay, in terms of CBT, maksudnya dengan psychologist ataupun dengan itu bantuan ubat lah. So how to deal with the anxiety problem? First of all, I have to know whether your anxiety is solely because you are worried. I'm not sure what are you worried about, okay, about the COVID-19, because there's so many problems that we are facing right now. Is this anxiety causing problems in your life or not? Is it affecting your daily activity? That's the first thing that normally we ask the patients. Of course, there's some criteria. But if this problem, no matter it's anxiety or it's depression, if it's affecting your life, for example, you're not doing your homework, you are not finishing your assessment, you are not going for your exams because you're afraid of COVID, then I know this kind of anxiety is already pathological. Dia tak normal. So when it's tak normal, kita kena treat lah. So treat dengan apa? Not only with nasihat. Just like depression, people can say, ayo, you ada depression. Can you be more happy? Don't be sad lah. Stay happy. You know, we always like to say this to people, but the problem you have to understand, mood is not a switch. It's not like we can turn happy, sad, anxious just by pressing on the button. It's not like that. It's very complex, isn't it? So it's irresponsible for us to just tell you, don't worry. That is bullshit. We have to really understand what's the core problem, okay? And then we see. If the anxiety is really pathological, then I would suggest you to contact a psychiatrist lah, ataupun psychologist lah, okay, to see. So we really have to see whether it affects you or not lah, okay, in terms of your personal life and also your activity. Yeah.
Ada banyak kriteria lah untuk
dia ada kriteria dia, tapi kriteria dia selain daripada achieving the criteria, dia kena affect you punya kehidupan lah. Okay, in terms of you memang kurang dalam you punya academic result ataupun you punya social life. It has to be, it's one of the criteria inside.
So basically kita tak boleh directly suruh orang tukar mood.
Memang tak boleh lah. Like a patient come with depression, it's not so easy to just ask them to stay happy. If you have seen a patient with depression, okay, you try to understand them, okay, they will really tell you the stories lah. It's not so easy. It's just that they have the feeling of not doing anything. They don't feel like they don't have the energy, they don't have the motivation. They are so sad. So it's not just like stay happy, because we are normal. We don't have the disease. Depression is a disease, okay, just like anxiety. Generalized anxiety disorder is a disease. Yeah, we cannot downplay it. Just say like it's a normal thing or what. No, we shouldn't do like that. So and it's not responsible for me to just give like the thingy, because I have to really truly assess the person first lah before I give medical advice.
I need to know the criteria first and
betul.
diagnose everything.
Betul.
Okay, the next question from Erica again.
Okay.
What's your thought on medical students, especially the clinical years going back to the hospital for clinical practice?
Okay. So for the previous question, actually, this has created a very big problem lah. Like my dear juniors, supposedly, like if nothing happened, they should actually have their exams in June. But because of this COVID, they just recently done their professional 3 exams. So this COVID actually really severely attacked them. Like if you ask my juniors, a lot of them, in the beginning, of course, in June time, when you say it's going to postpone, some of them are going to be very happy because they say, I can actually slack for a few more weeks or even months. But then at the end of the day, they will start to lose focus, right? They will start to lose direction, okay? And they will divert. So this is a big problem. But I'm not very sure nowadays, okay, how medical students are doing bedside teaching and stuff. Because for medical students, I always believe the most important thing will be bedside teaching lah. I'm not sure how is this going to be achieved, okay? It depends on the hospital protocol lah. So for that, I am not sure hospitals, I'm not sure whether we are using Hospital Sedang or the HUPM, because at my time, HUPM haven't fully built yet lah. So we are still using Hospital Sedang, Hospital Kajang. Nowadays, I'm not too sure. So I just advise Erica to stay updated, okay, with the newest update from your uni side lah, okay, for the practice. Because like us also in hospital, hari-hari tukar one, our protocol. It's not the same every day. Yeah, it's not fixed. It's like after one time they will change. depending on the current evidence lah.
Okay, another question from Fong Yan Bin. In your opinion, it is wise to allow the student to return to our respective university at March, given the ever-rising number of cases in Malaysia recently?
It's too early to say anything because that is in March, right? That is in March. And now we are just in January. So I also think that we shouldn't be too pessimistic. Kita tak perlu negatif sangat. Okay, menganggap dia memang akan naik secara mendadak macam tu. So, but of course, if the numbers are if the numbers continue to rise, that we have to really see the Kementerian lah, whether they want to continue or not. But for me, it depends on what field that you are taking. If your field has a lot of hands-ons, then of course you are going to lose a lot of your precious time lah. If you're doing online teaching, for example, in medicine, okay, you need to do a lot of bedside teachings. It's not just, you cannot just, I can't just give you a textbooks to read. So that we really have to weigh between academic and also the health. So we have to monitor the current situation lah. So January, now today is just 2nd of January. It's too early for us to tell whether in March we can reopen or not. But depends on the current situation, I would say.
So macam saya, course cell and molecular biology, memang ada banyak practical.
Kena tengok mikroskop semua. So
sekarang belajar ADL pun belajar teori je, no hands on.
Itulah masalah dia.
Yang merisaukan ialah bila intern nanti nak pegang equipment.
Itulah. So that's why I think that's the bad side. But at the same time, we also have to protect the students lah. So that one also have to depends on the Kementerian, see what kind of strategies that they can come up with to balance both things lah. But I think that only theory cannot lah. Memang tak boleh lah.
Semuanya bergantung pada kita, sama ada kita jaga SOP betul-betul.
Yeah, depends on the numbers lah, I think nowadays. Yeah, the more numbers are needed.
Okay. Question by intern Nabiha. Do the frontliners allowed to go home or do they need to stay at the hospital most of the time?
Frontliners mean like normal like us. Of course, we are allowed to go home lah. We can go home one, tak ada masalah. But then if you jaga like COVID ward, then maybe you need to like mandi first or what before you go back lah. So we are allowed to go home lah. Do we need to stay at hospital most of the time? For me, my working schedule, tetap punya schedule lah by KKM lah, is from 7 to 7. That is the minimum lah. That means from 7 in the morning to 7 at night. But the problem is, takkan you reach at 7? Cannot one. You need to assess the patient earlier one. So we will reach there maybe like 6 something. Okay, latest lah. Also is 6 something. We will need to reach there. Then at night maybe we stay a bit later. Okay, sometimes until 10, sometimes until 11. Latest for me when I was in orthopedic, I stay until 3 midnight. So whether do we spend most of our time in the hospital? If I tell you most of my time, half of my time have already spent in hospital, is that considered most? I'm not sure lah. But yeah, that's the case lah.
So jadual memang tak menentu lah, bergantung pada bilangan patient pada hari.
Bilangan patient, tapi kita memang boleh try to tetapkan kita punya jadual of the week. Kita tukar minggu-minggu punya. Not like every day ataupun every month lah. It's by minggu lah.
Question by Cincy. We need to check after we felt not feeling well, or we need to check frequently because this virus will hide in our body for a long time.
So virus hiding, this is talking about the masalah of incubation period. Maksudnya from the moment virus tu masuk dalam badan kita sampai kita develop gejala. So that is what we call as incubation period. Lah memang this depends on the different types of virus and also depends on the individual as well lah. So to answer the next question, that now generally the incubation period is 10 to 14 days lah. Now most of the time we adhere to 10 days. Kalau dalam 10 hari memang tak ada masalah, then memang they will consider you as low risk lah. Okay, so we need to check after we feel not feeling well, or we need to check frequently. So like I said, depends on what kind of symptoms do you have. Okay, so if you're really unsure, you can call any helpline. Okay, I think our government also set up a few websites for you to see what's your risk, and there's actually a strategy that they advise you to do. Okay, Don't just like straight away go to a private clinic that has no screening, okay? Because you might spread the virus to them if, let's say, you have lah. So basically, if you have symptoms, I would suggest you to call the KKM, okay? Or get the website, try to stratify yourself and try to arrange remotely first, okay? Then only we see how is it. Not advisable to straight away present yourself to the hospital lah. Okay, it's not really advisable unless you're really severe, very, very thorough, like really cannot really, like shortness of breath until cannot really, then that time you can present yourself to the hospital. But otherwise, I think you can go to the website, stratify yourself first, then see what's the next step that they propose you to do.
Okay. There are many questions from the floor, Doctor.
Okay, so this one, it's a very interesting question. This COVID-19 vaccine, I can share with you how interesting is it in terms of biology. In terms of vaccine, so apa tu vaccine sebenarnya? So vaccine is something that we insert into our body to trigger our white blood cells to produce antibody lah. Secara ringkas lah, dia macam tu. Okay, so most of the time we are injecting dead pathogens ataupun weaken punya pathogens. Maksudnya itu virus mungkin dia sudah mati ataupun dia sudah sangat weak. So kita bagi dia masuk dalam badan kita, then kita punya sel darah putih start to produce antibody to fight with it. But the interesting thing about this COVID is that we are not using the COVID virus itself. Kita guna dia punya mRNA. Tu ialah dia punya sequence lah, dia punya genetic sequence. We don't take the whole RNA, we take part of the RNA. Okay, then from this RNA, it triggers us to produce an antibody against a spike protein of the virus. Spike protein tu is a very important virus. It's a very important protein untuk virus tu masuk dalam kita punya sel badan. So you have to understand the whole flow first. In the vaccine, Pfizer and Moderna both are mRNA, both are RNA vaccine. Okay, maksudnya dia bukan the pathogens itself. It's just a sequence. It's just a code, okay, of the pathogen that trigger us to produce the antibody. In terms of whether it fulfill the Sharia or not, okay, or whether our Muslim friends can take it or not, that one we still have to wait for the clarification from Jakim and all. Okay, we still have to wait lah. But I can just tell you the content of it is like that. It's a genetic sequence, okay, of the virus, not the whole virus itself. It's just a genetic sequence of the virus. Other content, I'm not sure, but the main thing is that one. Yeah.
So from the mRNA to form the vaccines lah.
Yeah, that's the main ingredient. Into our body, kita akan produce antibody. If nak buat swab di klinik government, macam mana procedure dia? I can't answer fully to this question because I work in a hospital. I tak kerja kat klinik lah. Okay, but then buat swab, and let me just answer part of your question is actually how do we buat swab? Like I say, the most common swab that we do is actually OPS PCR, which is oropharyngeal swab. So normally what we do is there will be a very experienced healthcare professional. We will use a stick, okay, as something like this. So we will put the stick into the back of our throat. Okay, we take a sample, then we use the same stick, and then we take from the nose lah. So personally, I've experienced this just 2 weeks ago, and I can tell you the feeling is not as bad as most of you have imagined or have seen in the social media. Okay? A personal experience to tell you is that the swab is bearable, and you don't have anything like some people like after they poke, they say, "Oh, the mata sangat sakit lah, beraya lah." I have a few friends who have also done that. I can tell you it's not that bad. If you always ask me to rate from 0 to 10, 10 is very terrible. I can tell you I would rate it around 3 lah. Not very bad lah. Okay, so for the swab in clinic government, I would suggest you to call up the nearest KK to ask them what's the procedure lah, because I tak bekerja kat clinic, so I can't answer your question. Sorry.
Okay. Next question from JC Hor. Maybe I know it is safe to quarantine for 10 days only. In this case, how do they make sure the person is not infected?
Oh, this is actually also a very good question, because there is actually a recent study. If you look at up to date, there's a recent study, because previously the quarantine was actually 14 days previously lah. Okay, but now we actually changed to 10 days because they actually the study actually tried to weigh a few components. One of it is actually the adherence. So the thing is like this: the longer your quarantine is, the more the person is not going to follow. So at the end of the day, you say it's 14 days, but the person actually, 14 days sangat, very long, so come out even earlier. Okay, so that is the adherence lah. So 10 days, we can try to improve the adherence of the person, and studies have also shown that, like what I've told you just now, kalau dalam 10 hari, you tak bergejala, okay, nothing, like after you contact with the person, after 10 days, you got nothing. So it can be quite sure that you are actually negative lah. Okay, but cannot 100% because nothing is 100% in medical, but can be quite sure lah based on the current research studies. So 10 days, is it safe? Not 100%, but I can say it is quite safe. And if this case, how do they make sure the person is not infected? Like I said, there's no golden rule. For my friends who get quarantined, they have to get a second swab lah. Kena swab sekali lagi. So after you swab the first time, negative. After a few days, swab sekali lagi, negative. Wait for 10 days, potong gelang. That's the procedure lah. Okay, but for some people, maybe they are even older, then you might need to do a third swab. Swab yang kali ketiga lah. So that one kita ada itu protocol punya. So that one you don't have to be worried lah. Okay, we will explain to you. We will call you every day, so don't worry. The people will call you every day. Because I experienced it, they call me almost like every day. 1 day, 2-3 times to ask for the follow-ups and things lah.
Okay, next question is very interesting by Rulia Lee. What is your opinion on fomite transmission? Is it a potential route for the virus? If so, how can we deal with it?
Fomite transmission, there is no research that can tell that transmission is from fomite lah. Definitely, it's not really. No, there are a lot of papers lah. Actually, we try to see what's really the route of transmission. Okay, the most common one is actually droplet transmission. That means masa you bercakap ataupun bersin or cough comes out as a droplets. Some studies have shown that it might also be airborne. The difference between airborne and droplet is that droplet molecule is a bit heavy. So bila you patuk, dia akan jatuh lah. It won't stay in the air. Tapi kalau airborne, maksudnya dia punya itu virus akan stay in the air for a longer period of time. So it means the chance for you to get it is even higher. It's more infectious, so to say lah. So they believe that it's droplets, but some studies have shown that it could be airborne. But other route of transmission, like take for example bloodborne, or like in your case, fomite transmission is not well studied lah. There's no evidence that say that fomite can transmit COVID. Okay, so is it a potential route? Potential means is it a possible route? Like I say, medicine, there's nothing that is 100%, but the chance is very low lah, I would say. Okay, the chance is low. There's no research paper that show true fomite transmission. It's airborne lah. It's droplets. Okay. All right.
Soalan by Muhammad Abdullah. Still transmit COVID after getting vaccinated?
I am not very sure about this question. So, do you mean after you get vaccinated, do you transmit COVID? Now, a vaccine supposedly to be a prevention. Maksudnya lepas you dapatkan vaksin is a prevention. So, you tak akan dapat COVID lah. So, bila you tak akan dapat COVID, macam mana you transmit? Kan? So, if you get vaccinated and if the vaccine is efficacious, then you should not, it's working, then you should not get COVID. Okay, and if you should not get COVID, then you cannot transmit to other people lah. Okay, so if you're asking me after you get vaccinated, will you get COVID? Then I told you correct not? The vaccines you need to get 2 shots. You need to get a booster. So lepas booster, supposedly you should be safe lah. The efficacy is 95% lah, correct not? For Pfizer, okay. For Moderna, it's slightly lower, 94.1 like that. Okay, but for Pfizer, it's 95% lah, as the company has already research. So is it 100%? Not 100%, it's 95%. Yeah, that's the figure lah.
Okay, the second question. Can COVID-19 virus spread through mosquito bite?
This question I believe I said already just now. No well documented cases lah of other route of transmission besides droplets or airborne. Okay, but airborne also we don't really see that as a possible route lah. Most likely it's a droplet lah. Okay, so should we wear a mask even after getting vaccinated? Like I tell you, vaccine is still something that is quite new. We don't really get it yet right now. So we still don't know what's the protocol at the moment. We have to wait for more further actions planned by our government. Yes.
And we don't know whether it's effective in our environment.
That's why a lot of things that we have to take care of actually. That's why too early to say. Yeah, so we have to wait for this. This is actually a very good question. If a person is COVID positive once and cured, are there chances for them to get it again? Now, this is actually a very good question because there are some infections that we can actually get quite a long-term immunity against it. That means after you recover from it, maksudnya, if your white blood cells have produced the antibodies before, then supposedly when the pathogens get into your body again, you should be able to fight against it very fast. But for COVID, there is no well study. That's what I can tell you. There's no well study to talk about this, but there have been cases of reinfection. That is an answer that I can give you. There is no well-established study that there could be reinfection. No study on that. But there are reported cases of reinfection. Yeah, so that one you have to think about it. This is the quote from the research that I've read. It's from Up to Date. We prevent entirely getting the COVID-19. Like I tell you, even the proposed efficacy is at 95%. So that's why it's not 100%. So there is still a chance. Okay, anything also there's no 100%. Okay.
What is the difference between vaccine received in Malaysia and other countries? I heard there are complications on the patient at USA. Is there a chance Malaysia will be like that too?
So like I tell you, what kind of complications you're talking about? Everything also, they will have certain risks. We say risk for this vaccination. Most of the time is you have some fever reactions, or you will get some tangan, or your body will get weak, all that. But normally it's very transient. That means dia tak akan berlama lah. Okay, so it depends on what kind of complications. And of course, the vaccines that we get is not really produced by us. We also buy from the company that they're using. So most likely it's going to be the same. But like I say, we have not really studied the effect of this vaccine on our population in terms of our Asians lah. Okay, so we really didn't know about this lah. Okay, so we have to see. But hopefully there's no too bad of complications. Kalau dia macam kita boleh control punya, like a bit of fever or a bit of lengo or what, that one we can still take it lah. Penat or what, we can still take it. Okay.
Okay. Question by Safina. Is vaccination considered as the most effective way to prevent infectious disease?
The most effective way to prevent infectious disease is by preventing exposure. That is the most this is actually the most effective way to prevent infection. You're asking on infectious disease, right? So infectious disease, there are actually a lot. Like let's say, take for example, you're talking about HIV. So HIV is an infectious disease also. Okay, or let's say talk about hepatitis B. Hepatitis B is also an infectious disease. So if you ask me, what is actually the best way to prevent you against getting hepatitis B? Is it vaccination? I would say no. You try to avoid the activities that can give you the risk of contracting hepatitis B. Let's say unprotected sex, or let's say unnecessary blood transfusion, correct or not? So if you ask me, what is the best way to prevent infectious disease? Go back to the original public health prevention, is to adhere to strict SOP, clean your hand frequently, and also adhere to the guidelines that the government has provided. That is, I think, is the most effective way. If you don't expose to it, you will not get it. Vaccination is just like an additional protection for you lah.
Okay. Question by Nur Hazwani. Hi, doctor. From what I've learned, vaccine took around 10 years to fully develop and effective to be used. So what are your thoughts on the effects of the current COVID vaccine to the patients?
So basically, like what you say, I do agree with you, because a lot of medications we have to undergo clinical trials. We have like stage 1, stage 2, stage 3, stage 4, and it normally takes very, very long for us to develop a drug. But now it's a critical situation. So they actually have conducted the trials as well, but in a very fast manner lah. But then is it is it safe or not? Like I said, this one we from the data itself is generally safe lah. Okay, for the data itself, but is it really conclusive, like 100%? It's not really, because it's still something that is very new and we have just produced it in that short amount of time. But from the data that they've given, I can say that it is actually safe lah. Okay, better than risk yourself from getting the virus itself from the data itself. Yeah, I can conclude like that.
Soalan daripada Akmal Farhan. From your opinion, what is the side effect of RNA or DNA vaccine?
This is actually like I told you, it's a breakthrough lah. It's a breakthrough in science. I am not very sure is there any other side effects, but I can tell you that one of the questions that people always ask is, will this RNA vaccine alter our DNA? That's the very hot debate of topic. Maksudnya, sebab I already told you, the vaccine that we inject is an RNA, it's a genetic material. So will this genetic material change our genetic materials? But the current papers and studies have shown that the answer is no lah. Dia tak akan ubah kita punya genetic makeup lah. So other side effects we are still waiting to see, but until now there's no reported cases yet lah. Okay, there's no reported cases, but the previous debated topic is that lah. Okay, whether it changed our DNA or not, but the result is no. I believe this is the question that I have answered. How was the vaccine effect lah? So this one is still, we have to see lah. Okay, we have to see. Really very active this community. Very good. But
yeah, there are many questions for you today, Doctor.
Wow, very good all of you. Okay, so it's like a very active community.
Semua penonton curious about the situation right now, how it affects our
like I said, what I say tonight, okay, is from my personal experience lah. Can actually try to read up more resources. There are actually a lot of resources and researchers and study on the net that you can actually look for. Personally, I use the resource Up to Date. I think it's quite good because it comprises of a few research papers. Actually, that is quite reliable. I mean, yeah.
Okay, question by Nurul Nadira. The wearing mask will ensure 100% we won't get infected.
Of course, no lah. The answer is no, isn't it? If wearing mask can be ensure 100% won't get infected, then we don't have so many types of masks, right? We don't have like N95, we don't have like face masks. We can just wear the normal face mask and we can go around. If it's 100%, why do we have different types of masks? Because different types of masks, memang they have different, what do you call that? This filtration, okay? And also different degree of protection lah. But of course, nothing is 100%. Nothing is 100%. It could be the defect of the items itself. So here, maybe I can just use one example to bring out this analogy. So let's talk about condom. We talk about condom. So we all know that condom can prevent from getting pregnant or sexually transmitted disease. But if you have seen in the condom box at the back, they will tell you there is no method of contraception that can 100% prevent you from getting sexually transmitted disease or pregnancy. So even condom box also tell you that thing already. What about the mask? It's the same theory. Nothing is 100%. Okay? It's the same analogy lah. Okay? It's the same concept. Can we culture antibodies from the cured COVID patients? So this one, at one time, they actually tried to actually get the plasma of the patients who are recovered from the COVID, sort of like transfused. But at the end, they actually find that it is not effective. So no one is using that anymore right now. At one point, they actually said we can try to get the plasma because the antibodies are in the plasma from the patients and we give to the patients. But now they actually find that it's not effective. So no more lah. Yeah. Furthermore, if you understand plasma, if we take from this, what do you call that? Other people, it may contain other contaminants as well. So can we culture antibodies from the cured COVID patients? I can say, hopefully in the future, they can find a more safe methods on this lah. But now vaccine is the first thing they are trying to do first.
Another question by Akmal again.
You actually, correct. You need a booster dose lah. Like I told you just now, you need a booster dose. Okay, you need 2 shots. The second shot is a booster lah. Yeah. So it's produced instead of live attenuated or inactivated vaccine, because like I told you, it's the complex mechanism of the what do you call that? Of the mechanism of the vaccine. Normally, what we do is, okay, for normal vaccine we give dead or weakened pathogen, then we produce antibody against the pathogen itself. But currently for this vaccine, the RNA will trigger our body to produce an antibody to fight against the spike protein, which is a protein of the virus that helps the virus to get into the body cell. So that's the difference between live attenuated or inactivated vaccine. Because live attenuated vaccine, example is like our BCG, or example is like the yellow fever vaccine, or the MMR. Those are live vaccines, right? The concept is that we give the vaccines into your body, the pathogens into your body, but they are already weak. They can't create any problem. But we create antibody against it directly. Okay. Inactivated vaccine is the same theory, but this time the RNA is for us to produce an antibody against a spike protein, not against it's against a spike protein okay, for the pathogen. Yeah, so that's the difference. It's an indirect way. This vaccine is like an indirect way, not a direct way. That's the difference.
Question by Adam Daniel. What are the ethical considerations required to be made for fair and equitable distribution for these vaccines to Malaysian population?
One of the ethical issue is just now, I think one of the friends have already mentioned, is about whether is it safe to be used by the Muslim friends. So this one we still need more studies. But if you understand, actually we do have these anticoagulants that we actually use. We call it as a fondaparinux. It's actually also derived from the porcine, okay, which is not really halal, but then we normally will explain to the patient if it is for life-saving purposes, maybe it is fine. But that one, I'm not too sure on that. Okay, so other ethical consideration for fair and equitable distribution. This one, I will leave it to the common trend, okay, to decide how to distribute fairly, because there's so many of us. Correct? I think it would be good to distribute to the healthcare professionals first. Give to us first, so you protect us, so that we can protect the others, right? So give to the healthcare professionals first, then after that, we will slowly give down to the community step by step. That is my advice.
Okay, I think that's the final question for today, because you'll be talking for more than 1 hour.
Yeah, a bit dry. I mean, my mouth. Yeah. So is there fully confirmed that most of the new for this question, it does contribute. But is it really from eating animals? We're actually not sure. Like a lot of people say China there, they get is because they go and drink the bat soup. In the beginning, they say it's actually from the bat soup or from the... What we can confirm is, memang in that particular market of the Hubei province of China, memang they sell all those rare animals, and that market memang is the one that has got the first cluster is over there. Whether is it related or not, is it fully confirmed? I would say it's not fully confirmed. No one can tell you exactly that the first country is China. Okay, to be really honest, no one can tell you the first country is in China. Okay, now we are like saying China is the first country, but can you really be sure? Because there are some reports that say that actually way earlier back then in the US, actually they already got this strain already. Okay, but I'm not sure how true is that. So whether is it really from animals or not, we are not sure. But we can very guarantee right now it's human to human transmission. Okay, there's no reported case of animals to human transmission. It's human to human transmission in the moment. Yeah.
Okay, that's a wrap for the question today.
Yeah, thank you. A very active community, seriously.
Yeah, they love to ask questions because they want to know more about the current situation.
You can actually try to look up for more information. That's really good. I mean, university students should be like this. We are curious for knowledge. We're curious for things. It's really, really good. I'm so happy to be with all of you tonight. Yeah.
Okay, kita dah sampai kepada penghujung perkongsian kita pada malam ni. sebelum Syahmi mengakhiri perkongsian pada malam ni, nak ucapkan thank you so much Dr. Steven sebab sudi meluangkan masa untuk memberi perkongsian daripada kronologi pengalaman sendiri menguruskan pasien COVID. Nasihat doktor kami akan cuba aplikasikan
Yeah,
dalam
sure.
kehidupan kami.
No problem. I'm also very happy to be here tonight. Hopefully, it sheds some light on all of you. Yep. So, thank you so much. And
Semua penonton suka dengan sharing doktor malam ni.
yeah, girl. Okay, thank you so much.
Yes.
Yeah, thank you.
Okay, untuk semua penonton di rumah, kita masih belum menang lagi. Kalau anda kesihankan barisan frontliners kita, buatlah apa yang anda patut buat. Jaga SOP, jaga kebersihan diri. Kalau nak keluar rumah pun, if benda yang penting je, kita perlu keluar. Okay, sebelum semua penonton keluar daripada live ni, jangan lupa untuk scan QR code untuk sebagai bukti kehadiran anda. Nanti anda akan dapat e-merit dan e-certificate daripada Majlis Perwakilan Kolej 14. Terima kasih juga untuk semua penonton di rumah yang sudi meluangkan masa dalam sesi sharing dengan Dr. Steven malam ni. Okay, Doctor, thank you again for tonight.